In Uganda, a land once ravaged by the Lord's Resistance Army insurgency now stands as a testament to resilience and hope. The scars of war remain, but through initiatives like the Together project by ADRA Uganda, families and communities are overcoming the trauma of the past and building a brighter future. Opida Thomas and his wife, Lomoka Doreen, separated 7 years ago due to domestic violence. But thanks to ADRA Uganda's mentorship, coaching and capacity building programs, the couple has reconciled and rebuilt their home.
Yeah, this is my madam. We are together with her. We are now planning for development at home. We are together with the family. We are now working together. We are now setting our money nowadays together. We are now paying our children to school. This is the change, theory of change have got our mind. These are the two things what ADRA have done to us.
Yan ka mo kena mo na no tek ko bedati ka no na yot ki pon pa joni ya lo tiena madon ne no dongi ter ka kar wiyo man para ma choko ki ma chala anda ka lo tiena go be madon.
Odong Atanasio was once lost to alcohol, driving his wife and children away. Through ADRA's mentorship, he overcame his struggles and reunited with his family.
Mewara lutispa ADRA me o kalimwan kimina tina egang mamega kan ekar mo karangej mo karang ber ka winyo pon gi bar ADRA an pon ni na ma chen ma na ok atu no be pa pon pa ADRA chi utu donye chunya chalo dini ma no anati la marko ma tek tutwal ya lenyo kan
Ginying ma bedang yakada tugi kar me chot kur mu no dong chana lingi dang yer me yeo chot kar dang wa ka jola en man ko bedang wa ber ga chiel gilu tena wang o foni bedang lu tena kir me miyo tam kir me kwan e foni mogo ma bejo baro tena.
Beyond restoring families, the Together project has brought many school dropouts back to class. Domestic violence had forced these children out of school, but today they're back, learning and thriving.
We have a component called learning through play. Learning through play is a component where children are intentionally nurtured through their main activity, which is play. We make parents intentional in ensuring that their children learn while they play. So we teach parents on how to handle children. We also teach parents on the various play activities that they can use to enable their children grow wholesomely and holistically.
When we first started teaching in this school, or when the school first started, the enrollment of girls was very low. It was in the year 2021 when ADRA took over our school. So when those people came, a number of changes were brought in. They are helping us a lot in ensuring that girl-child education is promoted. They always train learners. There are times when they could come themselves and they organize for the training, while in some instances they have given us that opportunity to train our learners.
Chidong ma chier fonye ni kin fony ma noge ki fony kin me gwoke kar me menstruation ki kin me gwoke wek bidi gan kwan kidong kin me waramu gengo kere tim gero kidok bene ki wachi wani ka pego motie me ti kar ki ye wach kama leg wek konyi kede.
With the support of Straight Talk Africa and Mildmade, the program is not only benefiting students in school, but also those who had previously dropped out.
And we focus on sexual reproductive health and rights. Don't forget gender-based violence. We have a group and a number of them who are able to speak on their own. They claim for what belongs to them in terms of rights. They can tell their parents, it's time, we need school fees to go to school. But apart from that, the beauty is that the mode of our intervention in schools, where I said we have young people in clubs. So in clubs, they do more of communication in terms of drama.
We know how to control ourselves. We know how to behave in the community. And issue of backbiting also, we know how to control it, and they also help us in how to manage a business. Like for us, we have business. We have started a Casbox, which we are running it well.
To support nutrition, the Together project has introduced school gardens. This initiative ensures students have access to fresh food, reducing malnutrition levels. The same concept has been extended to homes, equipping families with seeds and knowledge to boost food security.
We enhance household nutrition and also household security to ensure that the girls and the children have better health.
Before we learned about kitchen gardening, we was just growing our crops or our vegetable anyhow without knowing how we can use a small garden and we benefit from them. So as what the Together project came, they taught us how we can make a small garden which they call kitchen gardening. So the way we are now training them, because they train us first, and we are now training each of every participant per quarter.
The joy of picking fresh fruits and vegetables from one's backyard is now a reality for many.
Does not require you, doesn't cost you very much. Just get this cow dung, you mix up with the soil, then after mixing it, then just get either this seed, could be for tomatoes or okra, then to plant it here.
Financial independence is a pillar of resilience. The Lawie Aduk Widow and Widowers Group was formed to help those who lost loved ones during the insurgency. Over 30 years, the group has evolved, attracting more members, including children. The money borrowed from these groups funds small businesses and emergencies, improving financial access and resilience.
Our mother started this group because of the effects of the war, whereby most of them lost their husbands. That is why our group is called Widow and Widower. For us, the children, we joined the group because of what our parents were also doing in the group. They were saving their money.
Kai dini kuo ke di share bulu mukene ki kwe bishu. Ka we mukene ini kuo ke de mukene churu ki tini gang kwan. Nena. Chok wa pe mon kar mi mon yene. Chok wa ruon yo wen to wa ngi gang ki tie. Chi wa dong kan wa ti ban mon to wa ti ka pier ti yang ki. Mu dong. En wa ko mi wa ti ko mete kere. Chi wa ti ko mi wa cha ko chu ni mwa. Mo ti ko mi mwa pa wi ario.
ADRA Uganda is empowering women through skills training, creating pathways for sustainable development. With practical skills, women can generate income and support their families. Menstrual hygiene management has transformed the lives of young girls. By providing education and sanitary materials, the project ensures girls stay in school and reduces the stigma around menstruation. From strengthening family bonds to improving education, nutrition, economic stability, and health, the Together project is a beacon of hope.
We have seen a lot of support from ADRA. One, in the aspect of supporting the health capacity building of the health workers to do their job. Then in two, a lot of improvement has been seen in the care of children, especially in the aspect of malnutrition care. Very many children have been screened for malnutrition and they have been managed just with the support from ADRA together with May. Then three, it has also empowered the staffs in the management of sexual gender-based violence cases. In our catchment, we have a lot of cases of violence, but people are not opening up. But I'm happy and glad to say that with the presence of ADRA, working together in conjunction with the May, we have greatly improved the care of people with sexual gender-based violence issues within the community. So we do encourage that ADRA, together with May Uganda, should continue to support the health facility staff as well as the community. Not only that, but we also send to information to our donors to support this agency so that we continue giving the services to our community members.
In the community, we train caregivers of under 5 children on management of nutrition of under 5 children. And we train them basically on the essential nutrition practices that they need to put in place to ensure that our children grow healthy.
There have been various mentorships, trainings done unto the staffs, and I want to say at least almost all the staffs in the facility were trained on how to manage SGBV cases, and we are doing that field great. Since we had very many cases in the 3 years we have seen, there is great improvement. They have also done a lot in mentoring us in nutrition and giving us more knowledge on how to manage our patients of sickle cell disease. They have done a great job there. We are grateful. ADRA has also been with us hand in hand in the sensitization, making sensitization to the community, creating awareness. They have also done a lot of community dialogues.
We have so far trained 92 healthcare workers on integrated SGBV SRHR so that they are able to deliver these services to these specific districts, and we work in 14 health facilities in all these 4 districts which we support. Under the community healthcare workers, we have trained 102 community healthcare workers, and under the community healthcare workers we have trained the VHTs, the police, which handles basically the legal aspect of the SGBV, Then we have also trained the parasocial workers, the health assistants that closely support the monitor and support the VHTs, and also the health inspectors, which are closely working with the VHTs.
Northern Uganda is rising, one family at a time. With the right support, resilience turns into progress. Together, we build a better tomorrow.
Thank you, Hadra.